sisters, I'm at home. My sister's recording me, that's why I'm not wearing a mask. So we're gonna start off by telling you the 3 sites for the subcutaneous injection. We have the posterior aspect of the upper arm. We have our abdomen, which is below the costal margin to the iliac crest, and we have the anterior aspect of the our thigh. So those are our 3 areas right here. Okay, I'm gonna bring you over here, washing my hands. First thing we're gonna do is we're gonna check. And we're gonna see that our patient is Oscar Simpson, the allergies are pollen and codeine, and date of birth is 11/11/1936. We're gonna see what is ordered for Oscar here, and it looks like it is epinephrine, 0.5 milligrams as needed, subcutaneous. We're giving it in 1 milligram per liter injection. Okay, and then we go ahead to my orders, healthcare provider's orders to see how that lines up. So Oscar Simpson, healthcare provider orders say the same thing. So it's 0.5 milligrams as needed subcutaneously for epinephrine. We're giving it through the injectable. It says may repeat every 10 to 15 minutes for anaphylactic reasons, and that's why we're giving it, is for anaphylaxis. Back up to the MAR. So I would grab my medication out of the medication chart, and maybe in a nice little bag that has everything labeled. So we'd have it here. We are gonna see Oscar Simpson is my patient, going down to epinephrine. Okay, so the drug is epinephrine. The dose is 0.5 milligrams as needed. The route is gonna be subcutaneous, and we are giving it now. Then I'm going to do calculations. So I have 0.5 milligrams divided by 1 milligram times 1 milliliter for 0.5 milliliters. And then I would check the expiration date on this, and it's not expired because we live in magical time, nothing expires. So we're good to go there. And then I'm going to learn about my medicine I'm giving. So epinephrine. For the allergic reactions, I know that the side effects are nervousness, restlessness, tremor, angina, arrhythmias, hypertension, tachycardia. I'm going to be assessing the lung sounds, respiratory pattern, pulse, and blood pressure before we give this drug. And I'm observing for a paradoxical bronchospasm, which is going to be like wheezing. Okay, I think I'm going to do the 1 milliliter syringe for this. I'm going to be using a 25 gauge 5/8 inch needle, and I'll be using a filter straw since we are using ampule, and I've already done my calculations. We're going to be giving 0.5 milliliters. This is all, of course, referenced in our SSC injection guide, which is right here. So we have the subcutaneous, we're giving 1 milliliters. We're going to give it to the thigh right here, and then these are the measurements that we're going to be using. Oh, wrong one. Okay, and after I do that, I'm gonna go ahead and prepare my stuff. So we're gonna get my ampule, we're gonna tap and make sure there's no liquid in the neck. Good to go. I'm gonna be breaking this away from my body at the little divot there. Okay, I'm gonna get rid of that in the sharps container. I'm gonna place this on a flat surface. I'm gonna be attaching my syringe to the filter straw without contaminating the plunger or the filter straw. Pull that out. We are going to go ahead and put that in here. Again, not contaminating the plunger. I'm going to go ahead and pull up as much as I can. So I gotta fight with it. It's got some little air bubbles. Okay. We're gonna get rid of those air bubbles, not infecting the plunger. All right, and then I'm going to go ahead and push it out to 0. Of course, I would do this in like a safer environment where, oh, we get all those bubbles. We do this in a place where it's designated to get rid of it, but right now I'm just gonna kind of do it over this. We're gonna do it to 0.5. I'm looking at eye level. Again, looking for no bubbles. Okay, and then we're going to remove this filter straw. And then instead we're gonna place on the needle. Again, tapping out anything we need to get rid of. And then I'm going to be labeling my needle with the name of the patient, which is Oscar Simpson. The medicine is epinephrine. The amount is 0.5 milligrams. My initials, the date, which is 11/11/2020, and the time is now. And then I'm going to take this and I'm going to compare it to my chart. So I have Oscar Simpson. We're going to do epinephrine. If I can find it. Epinephrine, the dose is 0.5. We're giving it subcutaneously. And then the time we're giving it is now. Okay, so that looks good to go. I'm gonna go ahead and gather all of my equipment needed. So I clean up my area a little bit, and then of course I bring all the stuff I need into my patient's room. Good. Washing my hands. Hello, my name's Abby. I'm gonna be your student nurse today.
Hello,
Hi, can you just give me your name and date of birth?
my name is Oscar Simpson and my date of birth is XXXXXXX.
All right, so I see that here on your band, and then I'm going to go ahead and check that in computer. Yeah, I have Oscar Simpson and the date of birth. Perfect. And do you have any allergies that you should be aware of?
Yes, pollen and Cody.
Okay, so I see that here on your band, and then that is in here as well. And what is your reaction to that?
Severe rashes.
Okay, awesome. Make sure you don't get that then. So today I'm going to be giving you a injection of 0.5 milligrams of epinephrine for your allergic reaction. Per your healthcare provider's orders, do you have any questions about that?
Nope.
Okay, awesome. I'm going to check the safety of the environment. So the bed is in the lowest position. We have our rails up. You have your call light. There's no clutter, and the wheels are locked. Are you comfortable?
Yes.
All right, so I'm going to go ahead and close this curtain for your privacy. Okay, so the first thing I'm going to do now is I will... I know this. Sorry, professors, 1 second. I'm going to teach. So I'm going to be doing my assessments first, actually. Oh my gosh. So I'll do my assessments, which would be the blood pressure, the pulse, the lung sounds, and the respiratory pattern. I would do those assessments, and then I would teach my patient about what I'm giving them. So we're giving you epinephrine. You just gotta let me know if you are having any wheezing. You know, it gets harder for you to breathe after I give you this medication because that can be a sign you're not reacting well to it, okay?
Okay.
All right, and I'll also be giving it to you in your thigh today, all right?
Okay.
All right. Okay, so I've taught you your stuff. I'm gonna go ahead and do my third check. So I'm gonna grab my labeled syringe. We do Oscar Simpson. Down to epinephrine. So it's gonna be 0.5 milligrams as needed. The route is subcutaneous, and the time we are giving it is now. You compare it, again, in my second check too, I'd wanna compare this to also the original med sheet along with this right here. So we have that done. After I did my third check, I'm gonna go ahead and put on some gloves. All right, and then I'm going to head and grab my stuff that I'm gonna need. Okay, so we would start, of course, by cleaning the area. Dispose of this. I would start in a circular motion going from inward, out, and then we're just gonna point out the area that was clean. Okay, and then I would let it air dry, and once that was ready, then I would, again, not contaminating the plunger here, I would uncap like a rainbow. gonna hold it like a dart in our hand. I can squeeze up to 2 inches, so we're gonna go at 90 degrees. So we're going to insert, and then I would steady it, and I would slowly push in the 0.5 without touching that plunger. I don't want to contaminate it. We're gonna pull it out, and I would place some light pressure onto here. We're not gonna rub it though. And I dispose this in my sharps container, up engaging the safety, and then I dispose it in my sharps container. But I'm not gonna do that since I'm a student. And then I'm gonna clean up my area for the patient. So clean up, clean up, clean up. I'm gonna take off my gloves and dispose of them as well, and then wash my hands. And we're gonna come over here and we're gonna document. For Oscar Simpson, I'm gonna go ahead and go in here. For epinephrine, updating my chart. So we're gonna give, say we gave it, we're giving 0.5. There's no rate. It was subcutaneous, that's all in here, that's good. Update the chart, the time we gave it is now. And then I'd also document any assessments I did, which would have been the blood pressure, the pulse, the lung sounds, respiratory pattern, you know, those kind of things, the lung assessment and the vital signs. And then I would just come back to my patient and check the safety of their environment. So the bed is in the lowest position. You have your call light, the wheels are locked, there's no clutter, and the rails are up. And then I'd ask, are you comfortable?
Yes.
Can I get you anything?
No.
All right, then I'm gonna go ahead and open this curtain and wash my hands.